Good afternoon, Sigonella. You are listening to 105.9 FM. It is the Eagle, or possibly you might be tuned in AFN 360 Sigonella if you are surfing the web. Maybe you're sitting at your desk, or maybe you're at home in the Achis. Either way, I want to say welcome to the show. That, my friends, was Flo Rida. The song is called Whistle. It is now 1:08 in the afternoon, and that means it is time for the most electrifying, dangerous hour of radio you can hear on AFN. That's right. It is Therapy Thursday. I'm the other guy. Lieutenant Commander Magel is in studio. Good afternoon. How you doing, ma'am?
I am doing fantastic. How are you?
I am also equally as wonderful. I'm excited. It's the 1 hour a week I get to be on the radio.
And dangerous.
Yes, dangerous.
I like being dangerous, too.
Yes. Mr. Controversy right here. But with all kidding aside, Therapy Thursday, it is your outlet, Sigonella, to contact mental health, maybe anonymously. This is an anonymous thing. We don't give out any names.
Nope.
With issues that you may have that are concerning you, that perhaps you're not ready to actually go into the office. You're not ready to make that appointment. But you know that, hey, I could
use some feedback.
I could use some feedback. This is your hour for that. And speaking of which, we actually have some questions that came in, and I'll let you kick it right off.
Okay, here is the first situation. I am a stay-at-home mom, married 15 years with a 14-year-old son and an 11-year-old daughter. For the past couple of years, I have felt emotionally distanced from my husband to the point that it's like we are just roommates. He doesn't like to talk about it, but I know it bothers him that I am disinterested. He isn't a bad husband, but I feel more like a maid than a mother and wife. My son leaves his dirty dishes in the sink, and my daughter makes a mess and doesn't clean up after herself. My husband works hard, and when he gets home, he is waiting for dinner, and sometimes I just don't feel like cooking or being his good little wife. I never complain, though, but I do quietly smolder inside, and sometimes I think I'm just going to yell at everyone.
From hearing this question, it seems to me that this is something that possibly more than just this woman may be feeling this way. It sounds like the listeners out there might be some people who can identify with her.
Absolutely.
Okay, she's talking 15 years of marriage, and she feels emotionally distanced. It triggers me to think back of a movie that I've seen called Date Night, where they talk about we've just become really, really excellent roommates.
Right.
And forgive me if I'm wrong. Right. That is something that, as a married couple, should we strive not to fall into that rut?
Well, it's a rut if you think it's a rut.
Okay.
And in this case, this woman is not happy with the feeling.
Right.
And there might be plenty of married couples who are perfectly content in that routine.
Okay.
But in her case, she's not happy about it. She feels like it's problematic.
Okay. And if she feels that way, then there is a problem.
There
right?
is a problem.
That perception is reality.
Yes, because if she is feeling like there's a problem, then there is a problem that's not being addressed. Now, what I hear in this scenario is typical life stuff. You know, she's got a couple of teenage kids, preteen and a teenager, and they're not real helpful around the house. You know, I mean, there's nothing extraordinary about that. She's got a husband who works. He comes home. He wants his dinner. You know, there's nothing in this scenario that sounds out of the ordinary for a typical family for a stay-at-home mom. Okay. But what does sound out of the ordinary is that she never complains and that she's quietly smoldering inside.
Okay, that's like a ticking time bomb, right?
Yes.
Okay.
It could be. And she says, and their husband's not talking about it. So that is what stands out for me in this situation, is that the husband's not talking about it, but she's aware he's unhappy, and she's not talking about it either. She's not saying anything to her husband or her kids about these issues.
Now, from the way that you're talking about it and the problem of the lack of communication, I'm going to go out on a limb and guess that you would say that communication is the key here. Like, she does need to start speaking up.
Absolutely. And so that would be my first question for her is, well, I would actually say to her, what happens when you tell your kids to clean up after themselves? What happens when you tell your 14-year-old to wash his dishes or put them in the dishwasher? I would just assume that she's already attempted that and see what she gets. Now, if she says to me, he just says, okay, I'll do it, and then never does it, okay, that's one way we need to approach it. But if she says, well, I don't ever ask him to, he just should know. He just should know that this is what he's supposed to do. Then we have a different problem that we have to deal with, and that's she has got some kind of block where she's having difficulty really expressing her needs. And these are not unreasonable needs. It is not unreasonable for a stay-at-home mother to expect help from her capable children and her husband to help with things around the house and help with the chores. And this is not unreasonable for her.
Okay.
And she's feeling emotionally distant I'm thinking because she's not communicating, she's not talking, she's not saying what her needs are.
Right.
When someone is failing to express their needs over a period of time, they will go dead inside.
Okay.
And I don't care how small the need is. If it's, I need you to clean up after yourself, and you fail to express that need over time, the resentment grows.
Right.
And when resentment grows, you go dead inside, and that emotional distancing can take place. So now you're no longer interested in your husband. Yeah.
Okay.
He's just no longer attractive to you because you can't tell him what you really think.
Now, from that perspective, you talked about the emotional distancing and becoming dead inside. How do you combat that? How do you keep that from happening? Is it just as simple as opening the lines of communication and asking for help, or is there something more or intrinsically greater than that you would have to do?
It's probably both, honestly, because the way I would work with someone who's having this issue is I would start small and I would say, okay, I want you to go home and I want you to ask your 14-year-old son to clean up after himself, and I want you to see what happens, because now we're going to get information from that. I'm going to be able to observe how she asks and then what occurs as a result of her asking, and then that will give us clues as to what to do next. So sometimes it is just as simple as starting to ask for what you need.
Okay.
But for some reason, it hasn't occurred to her that that's okay. So the deeper part is why has she tolerated this for so long that it's not okay just to get her basic needs met?
Right.
What's going on with her that this has been going on for so long that she can't simply say, you know, honey, I don't feel like cooking tonight. You cook, or let's go out, or just express whatever it is she's needing or feeling. She has kept it quiet. Why has that been okay over such a long period of time? And that's the deeper stuff that I would also want to address with her.
Is this something that could be learned behavior? Is it something that maybe it's not new? Maybe she's sort of internalized and kept quiet the entire time, like her whole life?
It could absolutely be the case. And so if that's true, then I'm delving more into, okay, well, what was life like growing up? When you expressed your desires and wants growing up, how did your family respond? What did your parents do when you said you wanted X, Y, or Z? Did they listen? Were they attentive? Did they respond? Or did they tell you to shut up? Did they punish you? Did they somehow communicate to you that you didn't have a right to have a voice?
Okay.
Because usually there's something that helps explain this tendency.
Right. Some sort of background issue. Now, listeners out there might be wondering to themselves, well, or asking the question, is this something where you make an appointment for family counseling or marriage counseling where you have, an unbiased third party there who sort of, I don't know, I'm going to say referees, but like just listens and sort of like sit the parents down with the kids and say, hey, this is the situation, and like listen to each other and do that in the safe confines of counseling?
You can, absolutely. Although probably in her case, I would want to just have her try it on her own first, because it might be a little too much to say just from this scenario, get your family into therapy.
Right.
It might be a little too much. I might say to her, well, why don't you get some coaching on how to communicate and see how that goes? And she could work individually with somebody first and see how that goes. And then if that's not working, then maybe start to involve the family.
Now, is there a difference between coaching and therapy? Like if you go, like going to an individual coach, is that the same as like one-on-one counseling, or is that different?
It's different, and I've actually heard that there are life coaches here in Sigonella.
Yeah.
Yeah. And so that's an option.
Okay.
That's not treatment, though. But people can try things like that.
Okay.
And
it's like the step. It's a step. It's
a step.
forward momentum.
Yes.
It's progress. It's moving forward in the direction that you theoretically would want to go.
Exactly.
Okay.
But her situation, like I said, it's a normal life situation she's describing. So I'm not going to jump into, oh my gosh, you need therapy. I'm going to say, okay, try these resources. Maybe get a book on assertive communication and see if you learn anything from that and if that's helpful. But again, there's probably this deeper issue of why she's tolerated this tendency for so long, this belief that it's not okay to say what she really thinks and feels, even on normal everyday things.
Right.
That may require a little bit more work, and that's when I would say individual therapy can be very useful for someone like that. And then she can learn to be more assertive at home, and most likely her family's going to respond just fine. They're going to go, okay. They're not going to give her much resistance. It's just that she never asks.
Yeah. Help out mom, kids.
Exactly.
And husband.
Help her out.
Yes. All right. We're going to take a short break. I want to remind everybody coming up very quickly. I want to say tomorrow they're going to have the tree lighting ceremony. None other than myself, the other guy. I'm going to be out there filming it, but we're going to take a short break right now to hear a little commercial about the tree lighting that's going to be taking place in Midtown. Don't go go anywhere, Signal. When we come back, we'll have more Therapy Thursday. That was Train with Drive By. You're listening to the station serving Signal is best 105.9 FM. It is the Eagle. It is 1:24, and you are back with the other guy and Lieutenant Commander Magel for Therapy Thursday. We just sort of touched on a stay-at-home mom who had become emotionally distanced. We're going to move on to a new question, although it's still family-related,
Yes,
I would say. Okay.
It is, absolutely. Here's the situation. I can't get my adult daughter to stop asking me to babysit.
Mm-hmm.
She has drug problems and doesn't have any money. Often she asks me to take care of her daughter, who is 6 years old, when it is not convenient for me. But I always say yes and then feel incredibly put upon and stressed out. I don't have the energy to take care of a young child, but I feel bad that she has a mother who isn't responsible.
Okay. Now, I'm going to ask you this.
Mm-hmm.
From my point of view, from the listener's perspective, is this question or is this problem, is it really, would it be sort of synonymous with the drug problem? Or would other parents be able to be like, hey, my grown adult children are not responsible and they're asking me to take their kids? Is the advice that we're going to give, is it going to be any different, seeing as that the daughter is a substance abuser as opposed to a non-substance abuser?
Well, I don't have much to say about the daughter who's using because she's not the one asking the question.
Okay.
But what I will say to the mother, she's saying, I can't get my adult daughter to stop asking me to babysit.
Right.
So she sees the problem as the daughter is not setting limits and boundaries. And what I would say to her is, you probably know this about your daughter, that she does not set limits or boundaries and is not respectful of your limits.
Right.
And it's not your daughter's responsibility, even if she were not using, to set your boundaries for you. It is your responsibility as a human being, mother or not, to be able to say, these are my limits.
Okay.
And if she's not doing that, because she says yes, because she feels bad that the 6-year-old doesn't have a responsible mother. There's so many issues here.
Yeah.
To talk to the woman who's writing this, that this sounds like codependency to me.
Okay.
And codependency is when you have someone in your family who is an alcoholic or a drug addict, the family members tend to change the way they relate in order to accommodate the person who's using. And it comes out in this codependent way, which is lack of boundaries, inability to really assert yourself, inability to be clear about who you are and what you think because you're so worried about the person who's using.
Okay.
That's part of what codependency can look like. And so for her, I would say this mother is in this codependent relationship with her daughter and hasn't learned how to set her own psychological and physical boundaries that she needs to do with someone who is using. Okay. She needs to be able to do that.
Right. Would it be a far stretch to say that she's enabling her daughter to continue?
Yeah, because absolutely. If she can't say no, then I would really challenge her and say, well, why can't you say no? And her answer would be, well, I feel bad. Her daughter, 6-year-old, has this mother who's irresponsible. And then my next question would be, is the 6-year-old in danger? And usually when I ask that question, I get some hemming and hawing.
Right.
And ultimately it's, look, if that child is in danger, you need to call Child Protective Services. If that child is being neglected or being mistreated because someone is using drugs and alcohol, then it's a no-brainer. You have to get Child Protective Services involved. Because if you're not doing that and you see that this child is in danger, you're not doing what you need to do. You're not protecting that child. Usually it's not at that level. Usually it's just, well, I don't like that my daughter doesn't have a job or isn't spending her money wisely, and so I feel bad for the 6-year-old.
Right.
It usually doesn't fall quite within the realm of abuse. So when we bring it back to reality and say, okay, so if it's not an issue of dangerousness, then you're doing this. You're doing this out of a sense of enabling or kind of a guilty feeling rather than really setting the boundaries for yourself about what is healthy for you. If you have physical limitations for any reason, medical, age, whatever it is, and you simply cannot take care of a 6-year-old, then you can't take care of a 6-year-old.
Right.
And you could set limits and say, I will watch her for an hour a week or once a week, for a day, whatever limits make sense to you. But to agree to anything more than that is enabling.
Right.
Absolutely enabling, and it's you not being able to really learn how to set appropriate boundaries for yourself. So I hear the problem is with the woman.
By not taking that stance.
By not taking that stance and understanding that her daughter has got a problem and that she can't expect anything different from her daughter. So her daughter is not going to set those limits.
Right.
This woman has to set those limits.
To play devil's advocate here, you said that she can't expect that from her daughter. Like, or as the devil's advocate here, I would say you certainly can expect your adult child to take that responsibility.
You
And that's
certainly
something
want
that
them
you should-
to.
Yeah.
You want them to. But
if they're not taking that responsibility,
then you can't expect it.
Well, I mean, you can make that. You can take that like, hey, by saying no, isn't that a way of forcing them to
It is.
take the responsibility of either finding alternate childcare or
Yes.
ultimately giving up whatever it was they were going to do to stay home and watch their own kid?
But that goes back to the woman being willing to say no.
Right.
She's waiting for the daughter to do the right thing. And I'm saying you can't expect that because your
Right.
experience with her is that she hasn't done the right thing for you. You
Yeah.
know, she hasn't respected your boundaries. So you can't expect that she will.
Right.
So you have to do it. As an individual, in any situation in life, if we look to other people to set our boundaries, we'll be disappointed and we'll feel bad.
Yeah, especially when the boundaries that the other person sets are not really within what you want.
Exactly.
Yeah.
So it's our responsibility. If we keep waiting for other people to do the right thing for us, then we're going to be disappointed and sad and upset and all of those things. So I would say to this woman, say no and learn how to tolerate the discomfort at saying no. Because this little child, if she's not being abused, then it's not an issue of you being a bad grandmother. It's an issue of just you having some very clear and strong and healthy boundaries so that you can be a good grandmother within the limits that you think are appropriate.
Okay. Fair enough. We are going to take a short break. We're going to take a listen to some Cage the Elephant. The song's called Ain't No Rest for the Wicked. You're listening to 105.9 FM, the station serving Signala's Best. That was Dispatch with 2 Coins. You're listening to the station serving Signala's Best, 105.9. It is now 1:39 in the afternoon. You are listening to The Other Guy and Lieutenant Commander Magel during Therapy Thursday. It is the most electrifying hour of the day.
That's right.
Yeah, there you go.
Of the world.
Of the world. There you go. I'm laying claim to that like Magellan. We've been talking about a mother whose grown-up daughter,
Yes.
has been asking her to babysit, and she's got some issues. We've touched on setting boundaries, codependence, and enabling,
Yes.
but there's more to talk about.
There's a little bit more in this scenario that I wanted to explore when she says, I say yes, but then I feel incredibly put upon and stressed out. Now, let me ask you something. If you say yes to something and then just feel all torn up inside as a result, what do you imagine is problematic with that situation? And you're doing this over and over and over and over. Right? You say yes to something, but really it's a bad situation for you.
Right.
You don't feel good about it. It's causing you stress, but you continue to say yes anyway.
Well, just off the top of it, you're putting yourself in a bad situation. You're not putting yourself first, and you are now going to cause added stress and anxiety into your life.
Yeah, you're not putting yourself first. And that's a tough one because people may do that if they believe that they are not supposed to put themselves first.
Oh.
So that comes from a deeper belief about the self, perhaps.
Now we're delving
Yeah.
into like self-worth?
Exactly.
Okay.
So if you are willing to tolerate bad situations,
Right.
then there may be some issues of how you believe you are as a person or what you deserve. You know, all that self-worth stuff. Why is it okay to tolerate something that you have decided is bad?
Right.
Why is that okay? And it might be that you don't think you deserve better or that you believe you are supposed to be self-sacrificing.
Okay.
But-
I mean, I would say, like, as a listener to this question, sort of peeking in through the window, it is her daughter, and I would go out on the limb and say maybe she feels like she's obligated
Yeah.
to watch her grandchild. Like, this isn't a stranger. It's not like somebody's asking something of you that you don't know as well. This is from the family,
Exactly.
nuclear family, extended, and you know she could say, hey, well, you know, it's my granddaughter. I have to look after her because my daughter, her mother is unwilling to do that. But that's
Well,
still...
and that's when I would get into, is this a child neglect situation?
Right.
You don't have to look after her. I mean, and you can call Child Protective Services if you believe that this child is in danger.
Now, is that common? Because it seems like it's a sort of, in my opinion, it would be like sort of that safe excuse for people to like be like, oh well, I have to do it. They're my kid.
Yes.
My granddaughter. Like, is that a common sort of out?
And I would really challenge that belief. If I have someone in my office who is saying that as a way to back up they're agreeing to a bad situation, I would really challenge the belief that they have to do it. I'm not saying that they're not going to continue to do this in some form or fashion, but I would rather it come from a place of I'm choosing to do this because it's really the right thing to do versus I have to do it, but I'm miserable doing it, and I have to do it because I'm obligated. You can do the same behavior from a completely different intention and not be stressed out anymore.
Right.
So I'd want to work with her on that in either changing her intention so that the stress level goes down or setting the appropriate boundaries, because if it's causing her to be ill, it's not good. She doesn't have to do it in the way that she's doing it.
Right.
There's probably another way. And it's not a black and white issue of no longer take care of this grandchild. It's how do we make this more doable for you? But if she believes that she has to self-sacrifice, if this may come from a belief that she's supposed to be this way, she's supposed to be the self-sacrificing person who is supposed to help other people no matter what. And I would really challenge that, because that only works if you don't get sick over it. If you can do that, if you can be that way and not get sick, then it's working.
Okay.
But if you get sick by self-sacrificing, I'm not sure anyone in the world would expect that of you.
Right.
It's not a healthy
thing.
thing.
Even your kids.
Even your kids.
Okay. All right, we're going to move on to the next question. This has something to do with PTSD?
Yes.
Okay.
Here's the situation. I was diagnosed with PTSD a while back, but have never really went for help. Initially, I saw a therapist for a few sessions, but I was PCSing within a few weeks, so therapy really didn't get off the ground. I felt like all we really did anyway was talk. Now that I am settled into my new duty station, I am more aware of my symptoms. I can't sleep, I feel moody all the time, and I don't want to think about the things which cause me to have PTSD. What do I need to do to get over this?
This specific topic, I mean, I know that there are some things in the military that service members will talk about. Like, we get training on it all the time. SAPR is one of them. Suicide prevention is one of them. They talk to you about PTSD. When you come back from deployment, you're supposed to go through the screening.
Right.
But PTSD is more common than people really think, because there's different levels to it, like, or different. I'm not sure what it's called. I'm calling them levels, but like you can have a mild form.
Sure, you
of
can have
PTSD.
mild, moderate, severe. Just
Right,
like any illness, it can be mild, moderate, severe. Absolutely.
Okay. To me, I would say, like, as a listener, he does need to get back in track with the therapy.
Yeah.
I mean, even though he's like, all they do is talk, communication is the key. Like,
Right.
to whether it's getting out of the emotional sort of what I forget what the first question was, the emotional distancing.
Yes.
Or being able to set your boundaries, or dealing with PTSD. Communication seems to be the underlying factor that seems to propel growth.
Absolutely. And it's unfortunate in the military. It's a way of life where we move every few years.
Yeah.
And if we develop a relationship with a doctor, it may end quickly, either because you're moving or they're moving.
Right.
And here's a situation where this person went for help initially, got diagnosed, but the therapy couldn't really get off the ground. And it's possible that therapist knew this person isn't going to be here long, they're PCSing, so they couldn't really engage in the proper evidence-based treatments that are available, because they do take some time.
Right.
So, for example, if I had somebody who came to my office who I had to diagnose with PTSD, but they're leaving in a few weeks, I'm not going to start treatment because I can't complete it.
Right.
But I will provide them support, and I will help them find the treatment that they need to have at their next duty station. I will help them with that process. I'm not going to just let them go flapping in the wind and have nothing. But we will be talking, but it's not going to be the kind of treatment that we can really do.
Right.
And this is, unfortunately, like I said, a sad situation. With all the moving, it's hard to stay in one place.
Yeah.
And it's hard to get the treatment that is available and out there. And we do have treatments available here in Sigonella, and we'll talk about that. But there's so much more available in the States, too.
Right.
And I always remind people of that for PTSD, there has been so many advances made, so many treatments available, so much research done, that we know so much more now than we did after the Vietnam War, for example. And a lot of that has come as a result of the Iraq war vets and the research that we've done as a result of their PTSD. We've made huge advancements and developed treatments which are incredible and actually work, and they have been tested and retested and tested and retested, and we know that they are effective. So someone who comes to a new duty station, they know they have this diagnosis, they know they probably need to help, get in sooner than later.
Okay.
One of the things that's important to remember about PTSD is that the hallmark of it is avoidance. There's always an excuse to avoid.
Right. Okay.
You will avoid your feelings, you will avoid your thoughts, you will avoid things that will remind you. And if you avoid going to treatment, that's just another form of avoidance. The PTSD will stay around.
Right. We're going to talk about treatment in just a minute. We're going to take a short break. We're going to hear it from the capital cities. The song is called Safe and Sound, and you will be safe and sound right here on 105.9 FM. It is the Eagle, the station that serves Sigonella. Don't go anywhere. We will be coming back to Therapy Thursday to talk about some treatments for PTSD. It is 1:55. You're listening to the station serving Sigonella's best 105.9 FM, The Eagle. That was Weezer with Back to the Shack. You are back to Therapy Thursday. I'm the other guy. I am joined by Lieutenant Commander Megal. We are talking PTSD, and there are actually 3 different types of treatment that people can seek out here in Sigonella.
Yes, there's basically 3 types, and actually a little bit more than just the 3, but I like to make sure people know what's available here. Okay. So in mental health, we can offer a few different things. On the psychotherapy side, which is a cognitive behavioral model called cognitive processing therapy, that is the model and the protocol that I give for PTSD. It is a 12-session model, so it's a commitment of time.
Okay.
And there's assignments and a little bit of homework that people have to do, and it's not labor intensive really, but there is some commitment to working on things outside of the session. Mm-hmm. I really love this model. I think it works really well. And basically what it's meant to do is to bring into balance all of the thoughts and the beliefs that have gone out of balance due to the trauma. Okay. When something traumatic happens, often our beliefs get skewed and we start to think things that we didn't think before. Right. And they might be an extreme. Was before we may have thought the world was generally a safe place. After a trauma, we may think the world is a very unsafe place. That's out of balance. Right. Because it's not true that the world is always unsafe. But through your experience, you've learned a thing or two that it's not always safe. Right. But to go to the extreme and say it's never a safe place is probably going to cause you a lot of anxiety when you're out in public or in situations that are unfamiliar. That's just a small example. Okay. But what we do is we identify those beliefs and we figure out how to bring them more into balance. And that's what CPT does. And it's all cognitive behavioral. Okay. That's cognitive behavior. It's called cognitive processing therapy. Okay. CPT. CPT. Okay. And what's the second? The other one is called EMDR, which it's short for eye movement desensitization and reprocessing. Okay. And it's similar in that it's used for trauma and it reduces the symptoms of PTSD. But it's a different kind of therapy. Right. And it often can take less than 12 sessions and there isn't homework involved. Okay. So depending on the person's situation, we will determine which treatment is the most appropriate. Okay. And it's nice to know that those are both available because they are both well documented to treat PTSD and trauma of different kinds, not just combat PTSD, but sexual assault or other kinds of traumas. We can use CPT and EMDR for any kind of PTSD. All right. Now you said there's 3. There is. Okay. So there's psychopharmacology, which means going to see a doctor, someone who prescribes medication, and you can get medications that can help you with your mood. Mm-hmm. So if you're anxious or depressed because of PTSD, then the docs can look at you and say, well, maybe an antidepressant or something to help with the anxiety can be useful. We also have medications for nightmares. Not really? Everyone knows that, but there is a medication out there that has been commonly used for PTSD nightmares. Okay. And what it does is it reduces the occurrence of nightmares and is very effective. There's also really good sleep medication that is not addictive. Okay. So oftentimes our patients who have PTSD who are also taking some medications have something to help them for sleep and maybe even the nightmares. Okay. And for mood if they need it. Right. But all of that's available. And I think we have a pretty good program of treatment for PTSD here. So please come and get the help if you need it. Most definitely. I will also educate you on all the other stuff that's available when you get back to the States. Awesome. That has been this Thursday's Therapy Thursday with Lieutenant Commander Megal. I want to thank you for tuning in. Make sure you tune in next Thursday at 1 o'clock. We will be back with the most electrifying hour of radio anywhere
in the
In the
world.
world.
Yeah. Before I leave you, though, I'm going to send you off with a quick message from the CEO on how to utilize the CEO inbox. We will see you next week, Sigonella. Have a good one.
Hi, Sigonella.